So any questions regarding dry eye disease, I have my personal card here. If you have any questions in the future, you feel free to reach out to me. And for questions regarding aesthetic art, we also have Angela's cards over here, I believe, and she's also here to answer any questions that you might have. The initial step, I'm not really sure if you've already had a dry eye assessment, but we would require you to come in for an assessment. So the assessment is $248. And our initial treatment plan for jet plasma treatment is 4 treatments, 1 week apart, and the fee for the treatment is $400 per session. And then once you decide to come in about 6 months or let's say 8-month mark, it would just be 1 session fee. So you won't have to repeat the whole thing all over again.
And what would you say, assuming you got MGD, what's the success rate?
It depends on severity. The glands that are there, we're not quite sure if they truly die off or they've just deflate and can be revived. It's still an unknown in the research community. So the answer is it depends. If there's something there to work with, much higher than if there's not much there to work with. So part of that dry eye assessment will take infrared images of the glands directly so we can get an actual look at it. So it's gonna vary by the patient, as well as we implement what we call a diagnostic expression. So we push up on the eyelids a little bit and get those meibum oils hopefully secreting a little bit, and then we can evaluate, all right, what's coming out of there? How does it look? How thick is it? What color is it? How terrible does it? And we grade these things and we come up with an idea of how beneficial it may or may not be for that particular person. But keep in mind, if there's MGD around, there's also probably a little bit of Demodex as well. These things like to tag along with each other, and the blepharitis, as well as potentially a mucus dysfunction of the goblet cells that secrete the mucus. So the focus has, even Dr. Barron and myself, we've been just pounded in our brain that the focus of dry eye is MGD, it's MGD, it's MGD, it's MGD. And that's all we were able to treat. The heat masks that you can buy, IPL, radio frequency. And so we kind of ignored the other 2 layers that are involved in our tear production. And it's with this that we can actually say, hey, there's something going on here. The little bit of a caveat is we can easily image the meibomian glands. There's not really a practical way of measuring the status of health of the goblet cells or the accessory lacrimal glands. We have different stains and drops that we can use to kind of see a bit of a picture of what these stains, they'll like dyes. And if there's dead tissue there, it soaks up the dye, so we can kind of get an idea, but not as easily as MGD. So MGD usually takes the center stage, but I say move over MGD and like in come everything else. Like we can finally do it now.
I mean, I'll say we've had the device now for 2 years. I would actually probably over 2 years now. So we're seeing really patients back, not just for 1 annual reevaluation, but a 2nd annual reevaluation. You know, I haven't had, and so in all my patients I've treated over the last 2 years, I've never had a patient who did not get any gains. I'll always have a patient come back with gains of some level, but again, it depends. And so we will paint a really, hopefully realistic picture of what your gains might be looking at the health of your particular surface. But again, if we have something to work with, I've never not had a patient say they're feeling better. I'll have patients who come back right at that 6-month mark, say, you know what, I feel it slipping a little, I want to get ahead of it. And then I've had patients where a year later and they're like, you know what, I still feel really good. So again, we go based off of a lot of what the patient says and feels. We're not here to push anyone into a treatment that they don't want, but we'll also gauge them with the measurements and the grading that we take. And when we reassess, we're looking at how stable are those tears on your eye, how fast are they evaporating. These are all numbers and measures we have. How easy is the meibum coming out of the glands? And we can also guide you. If you know what, your numbers were exceptional after treatment, they're starting to slide, do you want to go back to it? But again, it varies by individual.
So after the initial 4 treatments, let's assume a year later, you still have a few symptoms or whatever. Do you repeat the 4, or is it usually 1 session?
It will depend on the patient. I often like a touch-up session as 2 sessions. But again, there's still variability between patient and severity and symptom. But usually that first batch is that's what's been shown in the research to show the best, advantage. And then a touch-up of 2, depending. Some patients, from an affordability point of view, just want 1. But usually my recommendation is 2, or if I see that it's really come back with glaring symptoms, I might say let's start at 2, but if you're still symptomatic after 2, let's do a 3rd or a 4th. I think I only had 1 patient I ever had to do that with.
It's like fitness. You can do your own workout at home, and you can also have a personal trainer guide you along the way. So we kind of act as that personal trainer. We're giving you that really intense workout, and then you're off at your home. You still may be doing some drops. We may still be prescribing those medications for you to use in the eye drop form, the Cequa or the Restasis, those cyclosporins. We may still be asking you to do this, that, or the other. Personally, I've now kind of stay away from heat in some patients, but I still use it in others. It's really such a case by case. And depending on, I've been picking up the Arunalite more and more because it's very easy to use. And a person that has a lot of rosacea of the eyelids, I may not want to use a lot of heat there because that'll make the inflammation worse. But something like this is non-heat based, acts on the cellular level, combo with that with jet plasma that also works on the cellular level. We kind of have a 1-2 punch. And not to get off topic here, but there's lots of things in the eyes that have an inflammatory basis to, or a blood flow like implication, like in glaucoma, blood flow to the nerve, or macular degeneration, damage to the retinal cells in our macula. Red light is being hugely used in the States right now. There's an FDA approved device of red light of the same wavelength, except it costs tons of money to get it approved. So this is not approved for macular degeneration. It would be used off-label, but I digress. But the same technology is being used for those purposes.
I just want to ask about, Hugh already has a red light at home. He uses it for his RP.
Right.
I didn't know I could use it for my...
This, yes, definitely. Yeah,
How
yeah.
often? How long?
Every
What do I do?
other day,
Eyes open, eyes closed.
eyes closed, every other day, 3 minutes in the morning.
Okay.
Reason being, in the morning, the mitochondria cells are more active. They're kind of also regulated by your circadian rhythm. So when you go out early in the morning, those are the same kind of mitochondria that are more activated by blue light from the sun in the morning.
Before I wash my face and eyes.
Oh, it doesn't matter, as long as it's sometime in the morning.
Doesn't matter.
Yeah. If you open your eyes, it's just super bright and uncomfortable. You're not gonna hurt yourself. And not more than once, and not consecutive days. Too much of a good thing, in this case, is a bad thing. You can do really, really well, plateau here, and that's where we want to keep you. And then if you overuse it, you can drop below your baseline.
So did you say every day to use, because my husband...
Every other day in the morning.
3 minutes.
It'll automatically shut off. You don't need a timer. There's one button, very easy. It's on, push, it glows. It'll shut off after 3 minutes.
It also helps to reduce fine lines and wrinkles. Just
Yes,
saying.
yes.
It helps with collagen growth and stimulation. So I sit in front of my red light for...
I have a question.
Yes.
Are you talking about just dry eyes? Or
For red light, I kind of went off on a tangent, but
glaucoma, multiple surgeries? So how does it affect the treatments, like the jet treatment, the ocular pressure?
So the great thing about jet is that it doesn't really have a laundry list of adverse effects. It has some temporary side effects, like a little bit of redness or slight blurry vision, because we use gels when we do this, and it can get a little bit, cloggy.
You could do that.
But adverse events, if you have cataract, it's not going to affect cataracts. It's not going to cause glaucoma. It won't interfere with your eye pressure. We're not pushing on it.
But it won't make it worse. It won't
it's-
interact. The one counterindication we can absolutely not do jet plasma on is if you have a pacemaker.
Or any kind of implanted electrical device. Cochlear
'cause
implants.
It's an electrical pulse. But as long as you don't have a pacemaker or an
Pacemaker, but low pulse.
that's fine. but as long as you don't have any electrical device implanted into you, because there is an electrical wavelength going through you, you hold a grounding rod.
Yep.
As long as you don't, then there's really no counterindication. Whether you have glaucoma, macular degeneration, it will not worsen other eye diseases. It does not cause burns to
no
the
heat.
dry eye. There's no heat, so there's no burning, there's no skin depigmentation, which are things that you have to be cautionary about with something like IPL, can burn the skin.
At 4 times not here.
Yeah.
So that's good.
Yeah, it's really
Yeah.
for everybody. And when I have, a presentation that I use on a lecture circuit when I talk to fellow doctors, and I have a funny slide up there, at least I think it's funny because it's titled Indications for Use. And okay, can a person with MGD use it? Can a person with this form of dry eye use it? And my answer is everybody. The indication for use is everyone. And that is brand new to this industry. So there's always a little caveat, but with this,
Yeah,
it seems to be
we
quite
had
low.
a lot more limitations with the devices
Yeah.
before, whereas this one is just all more encompassing, more robust, and can be used on everyone with very little to no complications.
I'd say about 20% of my patients will experience like a little bit of a sandy feeling after, a little bit of singing. Chris, I mean, you feel nothing after. Yeah.
I drive home.
Yeah.
Yeah.
So it's a very low percentage that
I'll
actually
tell
feel
patients to
something.
wait and wait 5-10 minutes, and usually they're like, I'm fine.
Yeah.
Okay.